Turning to another big story, after weeks of decline, COVID infections are now in this country headed right back up towards the sky. Right now, there's an average of 3,300 cases reported every day across the country. Health officials say that number could quadruple to 12,000 a day by January, and that is if the Omicron variant, quote, successfully establishes and if we maintain current transmission levels. CBC's John Paul Tasker covering those projections. JP, walk us through some of them, particularly what the next few weeks are likely to look like.
Well, it doesn't look good. The Omicron variant really does have the potential to supercharge the number of new infections that we're reporting each day. It's just that much more transmissible. Right now, we're reporting about 3,300 cases a day. As you said there, David, has the potential to go up to 12,000 cases a day. And actually, there's even a worst case scenario. It could go to 26,000 cases a day if the Omicron variant is the dominant strain and if we maintain the current levels of transmission. So a massive potential increase coming there. The thing is, we know how transmissible it is. We've seen the data coming out of South Africa. Of course, their case counts were just kind of bobbing along there, and then they skyrocketed up, massive increases in only a matter of days. But we don't know how virulent this virus is just yet, this strain of the virus. We know that the number of cases that have been reported so far in Canada is about 90, although that number seems to be increasing every hour. But the cases that have been reported so far, all of them are mild or asymptomatic. So there's a question about just how sick someone can get if they actually get the Omicron variant. So that is potentially some good news for people, because while there might be a ton of cases, it might not actually stress the hospital system if it's not exactly that virulent, if people can kind of get by with just the two vaccines and able to kind of withstand the brunt of the Omicron. So that is still to be determined. The doctors, the public health officials saying today, there is work underway to determine just how effective the current two-dose regimen is against Omicron. One thing I should point out, though, is even if we don't have an Omicron wave, even if we don't see that take hold, as some of those modeling numbers suggest, there still is the potential for a wave of new cases in January after the holidays, a Delta-driven wave. They're expecting, with the current levels of transmission, about 7,000 or 8,000 cases a day, again, even if Omicron doesn't take hold. So the potential there for a spike is real. They are warning that it could stress hospital capacity, but we don't really know at this point. Dr. Howard New, the Deputy Chief Public Health Officer, is saying not the time to panic. We do have vaccine coverage. We're in a much better position than we were last Christmas, so we should still be wary of it. As to what we should do about Christmas festivities, Dr. Teresa Tam was asked about that, the Chief Medical Health Officer. She was asked about how do we gather as a family during the Christmas holidays. Here's what she had to say about that today. Take a look.
I think that keeping private gatherings small is actually quite important at this point while we learn more. I think that you can still have a really good time by linking with family or your immediate friends. We just want to keep things smoothed out and manageable. And so I think we're asking for everyone to collaborate so that you don't have to close schools and do all those things.
I also understand the health minister, Jean-Yves Duclos, was talking about travel. So many people, of course, travel over the holiday season, but there was a warning attached to that. Briefly, can you tell us what that was?
Yeah, he was saying that all travelers can expect a headache if they're coming back into Canada from a non-U.S. foreign destination. He's saying there will be delays. It will be, quote, a hassle, of course, because they have this mandatory arrival testing in place now. They're doing about 17,000 tests a day. It's slow to ramp up. They initially told us they'd be doing everybody. They're not doing everybody just yet, but they expect in January, when there's a huge whack of people coming back to Canada from abroad, that they will be administering arrival tests to each and every one of those people that come through the border at the airport. So you can imagine there will be long lines, people to process, lots of paperwork. It's not sounding like it's going to be great. Duclos warning people to maybe not travel at this time of year, because even if you're abroad, there could be restrictions that are put in place in those countries. It may be difficult to leave. It may be you could be facing a lockdown situation or constrained travel capacity. So he's really saying at this point in time, it's probably best to stay closer to home over the holidays. David?
John Paul Tasker here in Ottawa. Thanks very much.
Thank you.
Let's turn now to a reaction from the medical community. Dr. Alison McGeer is an infectious disease physician and a senior clinician scientist at the Sinai Health System. She is in Toronto, as is Dr. David Naylor, the co-chair of Canada's COVID-19 Immunity Task Force and a professor of medicine at the University of Toronto. Dr. Naylor, I'll start with you and then get Dr. McGeer's thoughts. We're seeing in these modeling projections a significant increase in the number of cases. But what should we read? That would be something that would have caused alarm in the pre-vaccine world. Should we be as alarmed when so many people in this country have been vaccinated and so many of those are now getting booster shots?
David, I think we still have to be very cautious. Obviously, the early data provide some comfort in terms of the number of people who are getting severely ill with Omicron. Some of the laboratory work is somewhat reassuring. Evidence that cell-mediated immunity persists could limit serious disease. But here's the math. Let's say it's half as virulent as Delta. And some people would say, well, if it grows twice as fast, that cancels out. But that's not how it works. It's exponential growth, so it's 2 times 2 times 2 times 2. So that math says even a variant that is milder can still pile up a lot of people who eventually, through sheer force of numbers, turn up substantial numbers of severely ill individuals. Let's not take that chance. Let's be prudent and patient in the weeks ahead and try to keep this under control. That's where I think many of us have come down.
And Dr. McGeer, I'll get you to pick up there because, what we know right now, and admittedly this can change, it has certainly in the past, but what we know right now is that most of those who are in ICUs, most of those who are seriously ill are unvaccinated. And among those who are not vaccinated, they're often come from more vulnerable segments of society. Is there any indication right now that would change as a result of Omicron, or is it still too early days?
It's still too early days. I think the first thing we need to start with is when we say milder disease, people have been talking about this as if it's the common cold. Whatever it is, that is not correct, okay? It may be better than Delta, but it's not a trivial illness. And so it's just completely unreasonable to say we can open up everything and let people get infected and it won't matter. It will very clearly matter dramatically for the 10% of people who are unvaccinated. And it may very well matter for people who've had 2 doses but not their third and who are older or more frail. It may be a very significant risk in our long-term care facilities. And as you just heard Dr. Naylor say, we still don't have really good data on how bad it's going to be, but it's not going to be good. And it just makes sense for us to be precautionary now so that we preserve the healthcare system so that we don't get back to the kind of outbreaks we've seen before. This is not an impossible situation. We can get through it. But we really do need to be more careful than we're being at the moment.
So let me go to the rubber meets the road moment. And Dr. Naylor, I'll start with you. People are going out to restaurants. We're heading towards the holidays when people will be gathering with families. We've heard Dr. Tam say, aim for smaller gatherings over larger gatherings. People will be getting on planes and going to international destinations. In the context of where we are, with what we do know and what we don't know, what would you suggest to people to do over the next several weeks?
I would go back to the same principles we've been trying to encourage through the fall, and that served us well in terms of slowing down Delta. And it's pretty simple, David. Now we have to keep the gatherings smaller. That office party that you might be planning for the holidays, good time to think about doing it virtually, because otherwise you're going to be in there and you'll have your choice. You can inhale Omicron or Delta when everybody gets voluble and crowds together. It's just not a smart thing to do. So small gatherings of trusted people, fully vaccinated, use rapid antigen tests also to screen out those who've been in circulation. As I've said before, and as the Minister of Health has said, I would travel sparingly here. Travel if you really need to, if it makes sense for all kinds of personal reasons and you feel compelled to do it. But in general, I would actually think about slowing down travel plans, parking them for a few weeks, until we see exactly where Omicron is going to land and what impact it's going to have. It's just a time to dial it back. Be careful. It should be a much better Christmas than last year, but let's not end up with a bad hangover after this festive season.
So, Dr. McGeer, I'll give you the opportunity to extend on that, but if you could also talk to booster shots and kids' vaccines and how that factors into this equation.
So, with vaccines, we are back to every dose matters now. So people who are eligible, we do know from what we know about the antibody response and the cell-mediated response to these vaccines that a third dose is going to help. And going to help significantly, particularly in people who are older and perhaps more frail. And so everybody who's eligible for a third dose should be going out to get their third dose now. It will offer you better protection, as you point out, not only against Omicron, but also against Delta, because Delta's not gone. And it does cause, severe disease in older, frail people as their immunity wanes. And the same thing applies to kids. We've now got 5 million children aged 5 to 11 in the United States who've been vaccinated with no safety signal. So when you get your kids vaccinated now, it's not like saying there were 3,000 in the clinical trial. There's a much larger number now. We've got much better data than we had even 3 weeks ago about the safety of vaccines. And, COVID may not be severe in kids, but it's definitely severe enough to warrant vaccination. Kids do get sick with it. They get long COVID symptoms. They get missed COVID. There are complications of COVID in children. And so the same thing applies to children getting vaccinated as applies to third doses. This is a really good time to go out and get vaccinated. And at least in Toronto, tomorrow is vaccine day in Toronto for kids. So a good time to get to one of the clinics and get vaccinated.
Dr. Naylor, in your assessment, should we be accelerating booster shots? We see that Ontario is the latest province to announce doing that. Another number of provinces have already gone to basically every adult 18 and up can go as of a certain date, and a date coming up soon in the case of Ontario, early January.
Yeah, I would be happier if we move faster, David, but I would say that the real priority, the place we have to move fastest, as Dr. McGeer said, is the frail elderly. Make sure those nursing homes and long-term care facilities are covered. Get to seniors in the community, people with immune compromise, people who are at highest risk, and then step down from there. But no vaccine slots should go unfilled. We need to really step this up, and let's get to the high-risk people first, and broaden as fast as we can to get to the adult population.
Dr. McGeer, I'll come back to you one more time just to ask, as you look at people who are weary after the now nearly 2 years of this, who had high hopes and who thought, okay, I'm vaccinated and I can undertake something that would have been more risky a year ago, what is the context that you want them to think in?
So, there is no question that this is really disappointing and really depressing. We were all hoping that we could have, a decent holiday season this year. But the problem is the virus doesn't care, okay? And I think we still all care about our friends and our family and our neighbors, the other people in our communities. And because of that, and because we want to get through this together and we want to keep our healthcare system functioning, it's really a time where we're going to have to dig deep and say we just need to be careful. It's not, it isn't going to last forever. It's really disappointing that it's getting longer, but this still doesn't mean it's not going to have an end date. It's just not going to have an end date when we wanted it to be.
All right. Discouraging news, but news nonetheless, and important information for us to have. Dr. McGeer, Dr. Naylor, as always, certainly appreciate you helping us sort of break through a lot of the information, understand what we do know.
Thank you, David.
Thanks, David. Bye-bye.
Bye.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.